Have you seen a trend like that with the colleagues as well?
Absolutely. And you've touched up on quite a few things, but I'm going to start with the last one in terms of the market. We as dentists, whether we like it or not, we provide and sell healthcare. Okay, people come and pay us to make them well. So I think it behooves any practitioner to be open-minded and look at what's available. Yes, there's other methods that have worked fairly well, but there's better materials, there's better techniques, there's better technologies. So I always tell industry that, we dentists are probably their primary consumer, but the real consumer is the patient. I call him the secondary consumer, and it's not probably a good way of representing them. I want to make them primary because they drive all this. They decide, they come to you, especially with now information so easily accessible online and everywhere. These patients come in, for the most part, fairly well informed. They're not necessarily well educated on the technology or the product, but they're informed. They know there's metal-free implants. They know there's ceramic. They're aware now of the sensitivities, the allergies, which is another something that we can talk about a little later. But yes, I've seen the patients come in either asking for these solutions like ceramic implants, or once educated on them, decide to switch to that particular option. Sometimes the cost, and most times I should say, the cost is not an issue. They look at it like, I am doing something that's going to be good for myself, for me. So I'm going to spend an extra whatever I need to spend to get a ceramic implant versus a conventional implant. Because the other resistance or rejection that we get, especially from practitioners, is the cost. They say, well, those implants are too expensive. Well, my patients cannot afford it. It goes back to the old days between bridges and implants. There were dentists who were saying, oh, my patients cannot do implants. Now we find that every dentist wants to know how to place implants. Hence, that's why we've been able to have courses over these years, and they keep growing and growing. So there was a time where, oh, implants are too expensive, they're not going to accept it, to where you're probably better off doing an implant because doing a bridge is probably a lot more invasive. So it's the same thing with ceramic implants. Okay, it's like you said in the beginning, it's not a new material, it's new to us here. It's, of course, costs more to produce and package and put on the market, but you find that the consumers, the patients, the ones that allow us to be able to go and purchase those implants for the manufacturers because they purchase our services, they're increasingly and exponentially going towards that type of solution. So yes, a short answer to your question is yes, I've experienced, and I started experiencing that when I incorporated ceramic implants in the early 2000s, the 2010s, that it was something that the consumer, the patients that we cater to, that we treat, are willing to accept, even if it means, a little more cost. And then we can also go into, how we go about incorporating these implants in our practices, but that's something that we can also explore a little later in our conversation.